our second talk. So we've already talked about GP training, so I've jumped up a bit. So now we're going to talk about foundation training, which is one of the basic training within the UK. It's like your house job within your homeland. So, and further to that, Dr. Muhammed Umair, who's in MBBS and he's an MRCP Part 1 at Hull Royal Infirmary. He's going to shed, after foundation training, he's going to shed more light on IMT training. So that's like a junior registrar. And once you have planned and decided you want to do medicine, and you're still not sure which specialty, this is just a step before your specialist training. So it's the IMT training. It contributes around 3 years of your career. And the last year is more of a step up or continuity role, in which if you've done your MRCP and you're good enough, you would be escalated to registrar level and treated as one. So over to you, Umair.
Yeah, my name is Umair. I'm one of the medical registrar working in Hull Royal Infirmary. Just given my email address, if you guys have any query about the presentation or any question, you can directly email me. So today we'll be talking about a brief thing about the foundation training, and then we'll go to IMT, which is my main focus today. So let me just go to the next slide. So IMT recruitment is the main topic. The website is given here. All the information we're talking about today you can find out in very detail on imtrecruitment.org.uk. So let's just start from IMT first. So what basically is IMT? It's just like international, when you come to UK and you want to get into training, as Mavish talked about the GP training. So we have different kind of trainings, and your main aim should be to get into a training program sooner rather than later. So the first thing is the GP training, the other thing is IMT training, and the other thing is ACCS training, which I'll just briefly talk about later. And then there's a surgical side, so you can get into a surgical training. So IMT is basically internal medicine training. It's a 3 years training program, which is recently been to like 3 years. It used to be 2 years. We used to call it core medical training. And during these 3 years, you have multiple placements of 4 to 6 months in mostly all medical specialties. Next, please. So how to get into training program, as Mavish talked about the GMC registration, so we'll not focus on that, but that's the main point. You need to have your GMC registration. The second thing is your foundation competencies. As we talked about the foundation competencies, which is called a CREST form. So some people prefer to do house job in Pakistan because the house job in Pakistan is only 1 year.
Mommy.
The house job in Pakistan is 1 year, and in the UK we call it foundation training. Like the house job here is 2 years. So some people prefer to do it back home in Pakistan and then come to the UK, get a non-training post, and then they sign off the form, which is a CREST form, which we talked about. And then some people want to come to the UK and start from foundation year 1, which is like really basic training. So the expectation level is really minimal, and you can start from the scratch in the UK. Then after that, you need to start planning for your application, start building your portfolio, which is a very important thing. I'll just briefly talk about that, because you need to have good points on your portfolio when you're applying for the interview. And after that, how will you apply for the training, and then what will be expected in the interview, and some offers and beyond. Next question, next slide please. So this is the foundation competencies. If you want to do your foundation training in Pakistan, which is a house job, after that, once you're in the UK, you need to get into a non-training post, work for a few months, which is minimum of 3 months, to sign your CREST form. All these forms you can download online, as Mavish talked about. It's about 10 to 12 pages. It's always changing, so it's better to have the updated form. Ask your supervisor who you've worked with for about 3 to 4 months. So just the basic things you have done, like your cannulation, you have done like taking bloods, consents. So it's like all basic things. Your consultant need to sign the form that they are confident enough that you can do all these. So this is the foundation competencies. If you're doing the foundation training here, like F1 and F2, you don't need to sign this competency form. But if you're doing in Pakistan, then you need to have this form before your training. Next slide, please. So then building your portfolio, which is a very important thing. The international medical graduates, we don't focus on portfolio. We just aim to try and get all these competencies, everything signed. But by the end, we don't have much on our portfolio, which is a great loss for all of us. Because there is no test to get into training. The only thing is, how is your portfolio, how much you have done before, and how you present in the interview. So they have all marks for these things. People who live in the UK, they know what the portfolio requirements are, and they score very high, and there we lose the plot. So next slide, please. So while you are preparing for your PLAB exam, your IELTS exam, or whatever you're doing, or when you are in non-training post, so these are few things you need to aim on. All these we can find online. So if you have any additional undergraduate degree, like people do BA, BSc back home, so they can get points for that. If you have any postgraduate degree, like MPhil, PhD or something, because they have good points on that. So this is from 0 to 6, the points just written in front are the maximum and minimum points. So if you don't have any undergraduate degree, if you don't have any postgraduate degree, you lose like 12 points on that. Then if you have any additional achievements, we'll talk about all these just briefly. Additional achievements, if you have any distinction, any awards or anything like that, like gold medals, anything, that counts, and you get good points for that. Then it comes to presentations, so you have really good points for presentation from 0 to 8. So if you have a regional presentation, you have like a national presentation, you have like international presentations. So these have really good marks, and you need to have a formal feedback for all these presentations, so you can put on your portfolio, which you can get when you get into UK, which is from the Royal College. Then if you have any teaching experience, which has good marks as well, from 0 to 6. So if you have done any teaching, because sometime when you finish your house job, people do get into a teaching job. So if you have done that has good points. Even if you do teaching on the wards, even if you do teaching to the medical students, get the feedback form signed and put these things on your portfolio, and you will get marks for that. Then it's teaching in training in teaching. So that's one of the courses they run here in the UK. It's like 1, 2, 3, 4 days course. Once you get in here, you can do that. It's just an easy course, and you get points for that. Then the other thing is quality improvement. So quality improvement back home, we're not very familiarized with this thing, but in the UK you need to do one quality improvement project every year. You can do that back home as well. Take something like really simple on the ward, which you can improve. Like if you want to see fluid prescription on the ward, how you prescribe, how much time you need to give, oxygen prescription on the ward, and just like simple things on the ward, you think you can make a change. So you can do a quality improvement project on that and sign from your supervisor, and you can get good points on that. And then some leadership and management. This is a simple thing you all can do during your house job, during your medical student. So leadership and management, if you are a rota coordinator for about 4 months, that is like a leadership or a management thing. You can like get a form signed from your supervisor, and you can get points for that. So these are all the things you can get points on your portfolio, and that will help you to get through the interview, because there's a lot of people applying for the interview, and all these basic points they count really much. Next slide, please. So this is just the basic thing. So additional undergraduate degrees, so they just like rank from 0 to 6. So whatever you have, you will get points accordingly. So they will just check all the details. And then next one. So this is your postgraduate degree. If you have PhD, if you have MD, direct in medicine, if you have all these degrees, so it ranks from 0 to 6. Next one. So these are about the additional achievement. All these you can find on the online websites. You can search it on imtrecruitment.org.uk, and you can find out all these information, and you can plan beforehand coming to the UK and while you're in the UK, so you can get maximum point for your interview. Next one, please. So presentations, like any presentation you do, try to do maximum presentations, national, international presentations. You get really good marks for all these, and then just sign the feedback form or ask one of your supervisor to give you some kind of a feedback, and just sign with all the details. Next one, please. This is about publications. We all are not very good in publication because there's no good research going on in back home, and we're just a bit on the back foot. But try to get involved in research, because there's very good chance of getting into research post in the UK as well. So if you have interest, you will easily get a job here. And you can see if you have any publications, national, international, and try to find out a website, try to search which are the best websites and recognize for your training. You can get good points for your presentations, the publications. Next one, please. That is teaching experience. So if you have any teaching experience, formal, informal teaching, if you're doing teaching on the wards, you get points for that. If you get like a proper teaching post for about 4 to 6 months, you get points for that. And all the teaching you're doing, you need to have feedback for that. Next one. Next one is this training in teaching, which you can do in the UK. I'm not sure about Pakistan if there's any training in teaching, but if there is any, you can find that online, and if they're recognized in the UK, you can definitely do that beforehand. So if you get really good points, all these 1-2 points, you would think that's just like a point or a two points, but that makes a huge difference when it comes to interview, when you have like 1,000 applicants or 500 applicants for 200 posts. So that makes a huge difference. Then it comes to your quality improvement. Next one is something we are not very familiarized. I'm not sure how it is in Pakistan nowadays, because it's not a part of the training. But here in the UK, if you get into training program every year or every 2 years, you need to do a quality improvement project. You can do it alone, you can do it with your friends. So 2 or 3 people can do that. So if you are the first presenter, you are the author, you are doing 2 cycles, so that multiple cycles, you can check that all online, and you get really good points on that. But if you don't have any quality improvement project, you lose like total 8 points. Next one is about leadership and management. So you need to try and familiarize with these things. How can you get points? So if you have like a university magazine and you're part of that, even if you're a part of a section of a magazine, you get points for that. If you do rota coordinator, you get points for that. Any events you have organized, you get points for that. So these are all leadership and management. So once you get through all these things, try to get maximum point before the interview. And then next one is, so once you're prepared, you have done your foundation training, or you have signed off your crest form, you have prepared your portfolio, then it comes to how will you apply. So there's an Oriel account you need to make for your training post, and that is the oriel.nhs.uk. The advertisement normally for the training of IMTs, it comes in end of the year. So this is just from the last year. They advertised in November, and then it just keep on going, and you will have all the plan beforehand. So when is the application opening, when can you apply, when the interviews will be, and when can you start. So these are all the details you can find online. So it mostly end of the year. Sometimes they have round 1 and round 2, which didn't have this time, but it keeps on changing, but you need to keep an eye. Then going back to the interview, so you have done your portfolio, you have applied for the post, and then you will be called for an interview. So there's no written test, there's only an interview to get into IMT program. The interview itself is a really easy interview if you're well prepared, and if you make your mind, like if you're getting to the medical program. It's a really straightforward thing. There's no hassle, nothing difficult in that. Next one. So the interview is just like a short interview for about 25 minutes, maximum 30 minutes. You have 3 stations in that. The first one is basically a clinical station, which you will be given a clinical scenario. There's like 2 or 3 examiners will be sitting. These days it's mostly online. I'm not sure if it's changed now. So you'll be given a clinical scenario, like a patient coming with asthma, a patient coming with diarrhea, a patient coming with headache, and these are some of the presenting complaints. How will you manage? And you just run through like A, B, C, D, E, and depending on the case. So, and after that you have ethical station. So as you all know, the ethical station, it is a bit different from what we have back home, because there's a lot of social involvement, there's a lot of family involvement in the patient care here. So all the ethical station, so you'll be given like something. A patient came in where he's elderly patient, really confused, not eating and drinking, kind of a dementia patient. The patient is deteriorating, the nutrition state is very poor. You want to put an NG tube. How will you do that? So these are some of the ethical bits. Whether you need to check like a patient, whether a patient is oriented, a patient has dementia, you need to talk to family. So these are a few bits. Once you get into UK and you start training here, you will know this, and it's quite straightforward, nothing really difficult in that. And then the main thing, as we talked about, the portfolio station. So portfolio station, they will talk about what have you done, and like if you have done any presentation, they can pick that. What have you done in your presentation? If you have any leadership and management, they can talk about that. So it's quite a nice interview, quite a straightforward. There's nothing difficult in that. Anybody can do it, if you are well prepared. And after that, once you have done with the interview, all your pre-interview score, during the interview score, you'll get a proper feedback of all your interview stations. After that, offer and beyond. So you will be getting offer. Everything you will find that mostly on Oriel. They can offer you about the placement. They will ask about preferences, where you want to get training, and it comes from top to bottom. And then you can respond to your offer, whether you want it or you want an upgrade. All these you will find out later on once you get into the training. Next one. So this was all about mostly the IMT training, which is generally if you want to do medicine, like any of the medical specialty, like respiratory, gynae, geriatrics, gastro. So you get this route. And there's another route which is called ACCS route, which is mostly for the acute people. If you want to get training in acute medicine, you can still get it through the IMT route, but mostly the emergency medicine, anesthetic, and the critical care medicine. This training is talked about. You need to have that LSRA exam beforehand, and then this mostly nowadays is 4 years training. So first 2 years are like 6 months rotations. You will get rotation in acute medicine, emergency medicine, anesthetics, and critical care medicine. Year 3 and 4 are mostly like IMTs. So IMT training, you get like medical rotations. It will be 4 months or 6 months. So after that, you get to choose where you want to go. You want to do emergency medicine, you want to train in anesthetics, or you want to do critical care medicine. So it's just about a brief slide on ACCS. If somebody is interested in doing emergency medicine, or if you want to do anesthetics, critical care, the ICU, you can do dual specialty as well. Next one. So it's just a brief summary what we talked about. So you need to get your GMC registration first, and we talked about that, how to get that. And then if you want to do your house job back home and you're coming to UK, you get in on the left side. So you non-training post, you get into a non-training post, but preferably get into a medical post. Not like if you want to do IMT, don't get into orthopedic post or something surgical post, because it's really hard to get your competency signed. And if you're coming to a training from a surgical specialty, you're not showing that you are committed to a specialty, and it's really hard to get the training. So get a non-training post, sign your alternate competency, which is a crest form if you have done your house job back home. Start building your portfolio for training, as we talked about. The alternate thing is, if you want to do foundation training in the UK, so you apply for foundation training, do your F1 and F2. You don't need a crest form after that because you're already signed off. After that, you apply for IMT. Just keep an eye when the application is opening. Apply for IMT, a 3 years training program, IMT 1, 2, 3. You have different rotations during your training. Start completing your MRCP, because by the end of IMT 3 you need to have your MRCP if you want to get into a specialty training. And once you're done with your IMT, MRCP, then you apply for higher training, which is the same process. You get through interview, portfolio stuff, and if you want to do any specialty, you can apply for multiple specialties. And then it starts from a specialty training year 4, and that's 4 years training now, and then you become a consultant. And after that, you have an exam in a specialty exam for every specialty as well. On the other hand, if you want to do ACCS, that's like if you want to do into acute training, you have 4 years training program, and you can get into intensive care, the ICU, ED, anesthetics, and you want to back to internal medicine, you still can change your mind. That's all from my side. Thank you, everyone. Thanks for listening. And if you have any questions, you can email me, or we can send any answers on the feedback form. Thank you.